Happy day. Today is Saturday, 28th July 2024. We are happy to meet you on this great occasion because we have so far treated 1,430 cases of Puberphonia. We really very happy about our achievement. Still, we are doing lot of work on Puberphonia because lot of time for me to think about Puberphonia. So this 1,430 means it is a very big stimulation for us. So what we are aiming is entirely a different scenario. What scenario? Now I am having a feeling, why not we start a small workshop every Saturday for those who are interested in learning about Puberphonia. It can be medical students, ENT postgraduate, ENT teachers, ENT scholars, and the important thing required is very, very important because it should be habituated. Everybody know in the world, Puberphonia voice people have double voice. Mostly, they will have the hidden low frequency also. Sometimes they shout, just like M.R. Radha. He is having high pitch and low pitch. So similarly, most of the people will have low pitch voice also. If they think for a while, they can talk. But they will forget. So we are creating a low pitch voice, that means a male voice. It should be maintained. For that only we are putting the thread in the uvula, so they will have a consciousness of low pitch. So they will be ever talking with the low pitch. It will become a habit. Habituation, everybody should know, it should be done by step by step. It won't come directly on a day. It is just like climbing down from a top to floor. Very simply, you can fly or jump from the top floor to ground floor. That is not good. You will injure yourself only. Step by step, you should come down. So that is the method of habituation. So I had a great opportunity that next month itself we are going to start a regular class for those who interested in treating Puberphonia. The primary person is ENT doctor, and it should be supported by those who are interested in manipulation therapy. See, we are not doing a speech therapy after our manipulation. We are only training them. We are not teaching a new voice at all. That is the thing everybody should understand. We are not teaching a new voice. So for that, I am happy to inform you, very, very happy, that entirely I am going to open a Puberphonia clinic. How you will enjoy. So my Siva ENT Hospital soon will be converted into a Puberphonia clinic. So fortunately, I am just occupying 3,500 square foot area of our Siva ENT Hospital as a Puberphonia clinic center. So this Puberphonia clinic center is a great help for me in treating Puberphonia boys, because all the boys are interested in coming to our hospital and taking treatment for 5 days. That training. The manipulation we are doing, it is a very good, and all are happy about our treatment, because we are doing the vocal rehabilitation. Try to understand. We are not doing speech therapy after the uvula manipulation. We are doing vocal rehabilitation. Rehabilitation means pitch, volume, quality. That is the degree of excellence, breath support, and the voice image are realigned to afford an optimal and effective voice. Try to understand. Our clinic, we are doing not speech therapy, entirely speech. Our concept is little different. We are doing voice rehabilitation. Rehabilitation means we are rehabilitating the voice in pitch, volume, quality, breath support, and vocal image, which are all realigned to afford and to give the optimum and effective voice. How great thing. So our treatment is redirecting laryngeal voice to pharyngeal voice. We adjust the voice placement, place the voice in the nasopharyngeal cavity, and producing uvular sound and abdominal breathing. This is our investigation, our finding, and our research. How we are doing the abdominal breathing. When you talk, you have to do abdominal breathing. Abdominal breathe and talk. So our own intention is, our own theory is, you move the hand. That is a great technique is there. We'll teach the students who are coming for training for puberphonia. So how you place the voice in the nasopharyngeal cavity? Excellent. You have to place the voice in the nasopharyngeal cavity. Thereby, you have to get the resonance at the nose and sinus. Do not deliver long sentences in one breath. Say few words and take a breath and then talk. Continue. So all these things can be trained by us in our Puberphonia clinic at Siva ENT Hospital. I have changed the appearance of our hospital as a Puberphonia clinic. Thereby, we'll give a correct quality of the pitch of the voice. We'll do the great degree of excellence, clarity, fluency, and volume. Volume means just the loudness and proper tone focus with a great, good breath support. See, here I want to say one more thing. Initially, the diagnosis itself make a diagnosis by hearing. So, our usual teaching for first year medical student is clinical examination start with inspection, palpation, percussion. Then cardiologist has included auscultation. Now I am a voice therapist. I am including the assessment of voice also. So hereafter it should be you just hear what the patient say and get the diagnosis. Just hearing itself you will get the diagnosis. Medical professionals are not know how to listen to the voice. So if you make a wrong diagnosis, if you are not listening properly, that is why we are missing and losing lot of patients with puberphonia, because we are not concentrating on the voice, how they perceive. Medical profession do not know how to listen to the voice. So how to get the correct volume, pitch, focus the tone and rate. And the breathing, whether this boy, when they're talking, they breathe by the abdomen or chest, or just pushing the words, or using the neck. So pitch increases as the frequency of the vibration increase. Pitch lower when the frequency decreases. Focus on tone, not from the vocal cord, from the cavity that make it in the pharynx and mouth. See, each speech sound should be modulated. Here, very important thing is we can change the voice, but the training should be done by puberphonia boys only. We cannot do the training. They have to get the training. For that only I am clearly telling, in our treatment, we are not only concentrating on focusing on there, definitely should be focused on pitch, volume, quality and breath sound. But the important thing is we are focusing on voice image. What is meant by voice image? Voice image means what you hear in your brain. That is called voice image. Whenever you get a correct voice, by Euler manipulation, it should be form a image in your brain. So that is what our brain training goes in puberphonia. That is the important thing that we consider. So this should be noted. So this had given us more knowledge on diplophonia or diphthongia. In diplophonia, two sounds of different pitch are produced. That is the cause by the quasi-pediatric vibration of the vocal cord, but no uniform interpretation of established mechanism. See, this we have to only because of the vocal cord. Purposely or had about pharyngeal voice. Harmonia. So two voices are there. My feeling is one is pharyngeal voice, another is laryngeal voice. So this is what I personally feel it needs definitely correction. So what we feel now, we are in the edge of proving it. We are making sufficient attempt to prove that vocal cords are vibrating, not all sounds. Some people are, even British people and American ear surgeons are accepting it, but more the vocal therapists, singers support me. If you whisper, you don't use the vocal cord at all. Very great thing I am finding in my research work. How in whisper the vocal cords are not vibrating. So I personally feel it is a very big research, and so it will give you a long help me to go ahead in the process. Clearly understand when we whisper. Whisper also makes sound. Mauna kural. Make less noise. In whisper, one great musician by name Robert Carothans. So Mr. Robert, he is a musician, producer. He accepts, and he has sent one mail also. When you whisper sound is coming. Vocal cords are not vibrating when you whisper the sound. Make a sound, but it is a whispering voice. There, vocal cords are not vibrating. Try to understand. When vocal cords are not vibrating, sound is coming, but there is no fundamental pitch, no harmonics at all. So, in that situation, I am not fully understanding it. When you are using the vocal cord, it vibrates. When you are not using the vocal cord in whispering the sound, so there is no vibration in the vocal cord. So similarly, vowel sounds are also, the vocal cords are not vibrating. See, here you should be able to understand there are 100 muscles which helps in forming a word. Predominantly vocal cord. But few sound, the vocal cord function is done by uvula or adjoining power or part of the short palate. Whatever movement uvula makes, the better movements are done at the level of the uvula. This we are aiming to prove. Our science and technology department of attached with me, some professors are helping me to find out the uvula is more active in some forming some words. This is clearly told by in Tamil literature. Sorry, I never want to winkle Tamil literature because most of the people won't accept But whatever may be, one great gentleman by name Kiape Viswanathan, Muttavil Kavalar. I just want to, yes, I want to tell what he has told in Tamil language. தமிழ் மொழி பேசவும் எழுதவும் எளிது. தமிழ் சொற்களில் 100 சொற்களை எடுத்துக்கொண்டால் ஒவ்வொன்றாக ஒலித்து பார்க்கலாம். ஒவ்வொன்றும் மேல் உதடு, கீழ் உதடு, மேற்பல், கீழ்ப்பல், நாக்கு, அண்ணாக்கு இவை கண்டே ஒலிப்பதாக இருக்கும். See what the Tamil scholar says. If you just take 100, it is just vocal tract cord. This is told by the great man Kalaimamani Dr. Kiape Viswanathan. He lived. The greatness of Tamil Noor, that book he has written in 1969. So I can definitely prove that we are using vocal cord, but with moment of the uvula, you can utilize in forming many words, and you can treat Puberphonia. So these are all the things, the reference he had taken from Tamil literature only, and I personally feel Tamil literature will help, and we are reading that, and this will give a great suggestion to us that what more we can do in Tamil literature. So this is actually supported to me by the great musician by name Robert in 1964 itself. He had presented a paper, and he says, when you whisper, there is no fundamental pitch, there is no harmonic. Very interesting. When you whisper, there is no fundamental pitch, no harmonics. That means when you whisper and make noise, there is no work for the vocal cord. But the sound is coming. The words are coming. How it is coming means there is some structure which acts like a vocal cord and create the sound which is modified in the mouth by the tongue, buccal cavity, and resonate in the nose and produce the sound. That is modulated in the mouth and nose. So already lot of proofs are there. Lot of evidence are there. But these things are not there in some of the English literature. That is a small drawback, because in English there is no log word at all. They are not put that word in the phonetic alphabet. So it is not there. So they are not using. The great scholars also left it. But if at all another chance is there, we will try to include, because these words are very important, and the Hebrew language, the words are there. Most of the Indian language also, the words are there. So a time will come that we will be able to prove that uvula or part of the short palate it acting similar to vocal cord or better than the vocal cord or more than the vocal cord. That is why we are aiming to form a entire puberphonia clinic at Siva ENT Hospital. But the thing is, when we say voice care, um, we want to concentrate only in adult voice assessment and therapy. What are the things needed? I have created. We have made a separate machine with a few lakhs. The voice assessment, it will immediately give whether your one's voice is high frequency or low frequency. So slowly we will build up this Puberphonia clinic to a great extent. I personally feel every week we will be upgrading our Puberphonia clinic. Then next month onwards, I have planned to teach the Puberphonia mostly freely. I am thinking over or with the little value it should have. So we will try to have a workshop. Every Saturday we will have a workshop and teach. I pray God that God will give great strength. It will give because we have two words primarily included in the therapy of Puberphonia. One is Amma, second is Om. This is a compulsory. We use Changu, okay, but primarily for low pitch habituation, we are using two words. One is Amma, and another thing is Om. This I have included in my paper, in my book, and in my articles also. So thank you very much. We will try to meet with new ideas, new things, and new research with good people who are supporting us. So happy to meet you next Saturday. So we are happy that today, 20th July 2024, 2024, we have finished 1,430 cases of pneumonia. Hope to see you next Saturday.